By participating hand washing or hand hygiene, we can prevent illnesses. Not just prevent illnesses, also reduce healthcare costs and promote economic resilience. To join me on this conversation this morning is Dr. Chijoke Otiba. He is a physiotherapist and holistic.
Good morning, Trish.
Welcome to Health and World Show on the Frequency Radio 104.9 FM, Abuja. Trust you are doing good this morning.
Amazingly.
Okay, so in case you have questions and observations, or you maybe have an experience you would love to share, a doctor's in the building, all you have to do is call in. The studio line is 0810 885 1189. Okay, 0810 885 1189. And also, you can send in WhatsApp messages, also voice notes to our WhatsApp line 0906 199 9009. Remember, keep it short and simple and clean when you want to send in your messages, also voice notes, or in case you want to call in. All right, so doctor, why are clean hands still important?
Clean hands are important for many reasons. It's important for many reasons. One of them being that it reduces the spread of diseases,
Okay.
especially communicable diseases. Diseases that can be shared from one person or contacted from another person just through contaminated surfaces, touching contaminated surfaces,
Okay.
or sweats or body fluids or whatever. So it reduces the risk of passing such diseases to other people. And again, it reduces healthcare costs. Come on, preventive healthcare. I believe preventive healthcare is the best form of healthcare.
Mm.
So why do we let something happen and then we start spending a lot of money on managing or treating that when we could have actually prevented them? So it's actually very important.
Okay. So, what are the basic benefits of clean hands?
Basic benefits of clean hands:
Mhm,
prevention of diseases.
mhm.
Helps to prevent diseases, helps to reduce personal costs and the personal, the burden on healthcare on the government. The amount of money that is going into healthcare, into managing contingencies and emergency breakouts and all that. The pandemic breakout and all the amount of money that is going in can actually be reduced to an extent
Used for
if
something else.
yes, and used for something else if
Okay.
we're even able to adhere to some of these hand hygiene principles or
Okay.
techniques.
Right, so can you just go ahead to tell us few of the hand hygiene?
Okay,
Yeah,
so
because I actually wanted asking you this question before you brought up the other one, but let's do this. I know the WHO has directives on hand washing, right? Could you just go ahead to give us that one?
okay, so for the WHO directive on hand washing,
Mhm.
I actually stumbled on this the first time
Mhm.
during the COVID-19 pandemic. So I did a
Really?
program on, breaking the cycle. I did
Okay.
a program on managing, containing the pandemic and all that. I did a lot of public health courses at that time. Just because I was, I'd say I was panicking at some point because I
Mm.
really wanted to know what's the information, what's the right information. Some people are going to say this, bathe with salt, drink
Yeah.
salt, do all sorts
Yeah.
of things.
Yeah.
But along the line, I stumbled on that and I discovered there are actually like 7 steps,
Mm.
to hand washing. So this is if you're going to keep to hand hygiene practices, you are going to the principle there, looking at the 7 steps. The principle is basically more than following the steps, in line the way it is or the way it was given. It's
Mhm.
actually getting all the curves and crevices in your hands
Oh wow.
because it's something that a lot of people don't do.
Just wash
I
it sharp, sharp, sharp.
exactly. I plan to leave this violence for later, but let me bring it now.
Ah.
The way elderly people, the way they wash their hands, they just put their hands in water. And this is someone that wants to swallow a bar, hot fufu and a goosey soup. The way they want to, I mean, when you bring water for them to wash their hands, one is in a hand, is in a bowl,
Yeah.
and water that we don't even know whether the water is clean enough. And then you put your hand in the water and then you just do it like this.
Mhm.
And just wriggle the hands, and then thank you very much, you got the word. And then they fling it off, and what you just successfully did, exactly, what you just successfully did at that point is giving the bacteria, the germs, whatever, a nice, comfortable breathing space.
Wow.
For them to do whatever they want to do and multiply.
Really?
Exactly.
Wow.
So the principle there, the 7 steps following the WHO 7 steps, sometimes you see 6, sometimes you see up to 9, depending on the stages. Now you're trying to get
different stages.
Yes.
Oh, wow.
So there are steps.
Okay, there's steps
for hand washing.
Okay.
So you
say there are 7 steps.
Yes, 7 steps.
Okay.
So now 9 broad steps, but then so what do I mean? Now the first thing you are doing is wet the hands. Okay, wet the hands, and remember to wash your hands under clean running water.
What if you don't get to find running water?
Carry the water in a bowl or in a cup or something, and somebody can help you pour clean water while you wash. So the goal is that you're washing the germs and whatever, they are falling off somewhere and they're going to get flushed out.
Okay, so your point exactly is don't wash your hand in a bowl with soap and water.
Exactly.
It has to flow.
Yes.
Okay.
Yes.
Okay.
So now when you wet the hands, the next step is to get the soap and apply, and let the soap lather well. Let it lather well. Rub around.
In layman terms, let it sink well. Let it enter well.
Let the foam
let it foam
let it foam well.
Okay.
So it's not all this, there's some soaps that if you're using them, they don't really soap, they don't really foam. You're not really wondering exactly. So let it foam well and spread across your hands. So I'm going to throw more insight about UNICEF, UNICEF convention, because I okay, don't worry, that should be one of the things I'll talk about later. Now you lather the hand, and then you start getting the inner side of the digits, the fingers. So you are rubbing the inner side of the fingers, this small V-shaped. Yes, you are trying to get those points. You use the left to go to the right, use the right to go to the left, and then when you are done, you go to the back, and scrub the back of the fingers also into that inner side, also into the inner side of the fingers, those V-shaped parts, and then you now start going all through the digits. You turn the hand. It's going to be easier to understand if you're watching it as a video display, but you can just look out for the WHO steps for hand washing and all. Quite an interesting stuff. So you scrub the hands thoroughly, the fingers with soap.
Oh, I think it was with sponge.
No, scrub thoroughly with soap. You are using one hand to go to the other one, and then the next thing you're now trying to do is the nails, the finger. Okay,
what about people that have long fingernails?
And that's
not fixed nails now.
Yeah,
naturally long nails.
Now that's where the problem is.
Okay.
Because you at some point you would have to cut them off. You have to at least trim them to a point that if you want to wash the hands, it's not going to be a problem. The aestheticness, I doubt there's any English word like that, but you understand what I'm trying to explain. The beauty of those fingernails are not worth to be compared with the illness that they can bring. Okay, so as much as possible, unless you are going to specifically maybe get a fingernail brush, a small brush that you'll be using to ensure that you are brushing inside. Because I've seen this, a lot of people do it. Some sleep-ins, tactical sleep-ins, they want to eat eba, back to fufu and egusi soup, and then they puncture it breaks my heart. It pierces my heart. They puncture the thing and they grab the scoop, and I'm wondering, did they really brush inside that? Apart from the disrespect on the fufusha, on the swallow, did they really, brush? So there's a lot of okay. I promise I'll not talk about food again. I will not talk about food
because
except
we're talking about food and we foodie, so you can imagine how you're potting me right
now. So now they don't intentionally go to start scrubbing inside the what's it called, the nails. Okay, So now you wash the nails, you try to clean up, and that's why it's also good to trim them to be really, really,
Neat
to
and
be neat,
short.
exactly. And then the next one, you go around the thumbs. You go around the thumbs,
Wait, all this process is just to
exactly.
eat.
Even if
So
it's not
after
just to
the
eat,
food, okay, even if it's just to
yes,
eat,
you want to wash your
because
hand.
I know naturally you're meant to wash your hands regularly
Yes,
when you use the restroom, after you use the
exactly,
restroom, when
exactly,
before you touch your face, because it's
exactly.
important. It also spreads germs to your face.
Mm-hmm.
The door hand, how many people hand don't go there where their hands don't dey, where they don't scratch and
Elevator
all of that.
button, toilet
Do
doors.
you get that? Is why hand sanitizers are also important. So imagine you having hand sanitizer in your pocket for the men, and then for the ladies, your handbags. I have it too. It's in my me. If I not see water to wash hand, I'll just use that. But we're going to talk about the difference between hand sanitizer and hand water with soap
Yes,
as
yes,
along the show.
yes. So it's also important. Let me bring this up. Okay, now I'm not done with the
Yeah, 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 yeah.
WHO, whatever. Then the next one is the wrist, scrubbing around the wrists,
What does the wrist have to do with?
Now, let me chip in. When I was in my fourth, I think it was my primary three. I wanted to say 300 level. When I was in my primary three, we were taken for an excursion, Women Development Center, when I was in the East, Oka, and UNICEF sponsored a program that I attended. I can't even remember the name of the program, but it was sponsored by them. So that was where it was a program. That was where they taught us about hand washing.
Wow.
Pretty interesting thing. At that point, it was like, okay, wash your hand with soap and clean water over running water, not in a stagnant bowl or stagnant water. And then when you are done scrubbing, ensure that you get at least 20 seconds. I remember those tips then. And the next thing is you should get to your elbow. As children, you play a lot, you go for break time, you play with sand and all that stuff. So as much as possible, the structures around your hand, please do wash them as well. So we learned to wash straight to the elbow, and that habit stuck with me even up till today. A lot of times when I wash my hands in public, if you're around me, you may laugh at me because I try at least to get to my forearm. I mean, midway from my hand to my elbow. So it's also very important. So there was something else I wanted to comment on.
The 7 steps.
Yeah, no.
Then you talked about the washing of the hands to your elbow.
Yes.
Okay. And then you said that was where you stopped. Yes. Where you told us the story of how you were in primary 3 and then you were taught by UNICEF on how to wash your hands regularly.
Mm-hmm.
I'm listening.
That's it.
Okay, so now let's take a look at all the questions. But before then, I want you to know that you are listening to Health and Wealth Show on the Bokesi Radio 104.9 FM Abuja with Trish. And also I have my doctor in the building, Dr. Chijo K. Thank you so much for coming, and also thank you so much for discussing this topic with me. Yesterday was Global Hand Washing Day, and it has been celebrated annually every annually 15th of October. Okay, so this year's theme sounds like a question. It's more of a question. Why are clean hands still important? And then I told us that it is a thought provoking question that encourages us to reflect on the significance of hand hygiene. And then we also told you how crucial it is, and then how it defends against the spread of infections, illnesses, and harmful germs, whether in the hospital, schools, or our everyday interactions. So, doctor, moving into more question, what is the most critical time for hand washing to prevent the spread of infections?
Okay. Now I'm going to mention different things as much as I can remember. Now, food is one. 2, toilet. Restroom, toilet. 3, contaminated surfaces. 4, sick people. And 5, let's start with the 4. 5 will come. So the first one is before and after eating, particularly before. Okay, because You see, we underestimate the amount of exposure that we get with contamination, with germs, with viruses every single day. Thank God for our immune system that fights a lot of things off. Thank God for white blood cells. Thank God for our body protective response. However, we shouldn't, because some people will say, oh, disease not a kill African man. What a man doesn't know kill him. Oh, this is how our fathers have been doing it. This is how they've been eating swallow. Yeah. You want me to now come and be stressing myself to wash my hand with soap and clean water? No. Now we underestimate the amount of exposure that we get. We underestimate the amount of load we are putting our systems in. And sometimes when people break down, they don't really know that this is like a cumulative effect of what they've been doing to their own body systems. Okay. So you go out every day, the people you're giving handshakes to, you barely know them. You don't know how their own hand hygiene is. The person that you shook hands with probably used his hands to do some dirty business before coming out, and didn't even wash properly.
Money and all of that. Now, have you gone to the bank of recent to see kind of smelly and dirty money?
Thank you.
Is being shared?
Thank you. The way some people even count the money, you know what they use as their, thank you. So it's very irritating. It's messy, beyond even counting money, beyond the use of spittle to turn the money and all that. How about people who do not really do proper washing after using the restroom? They do it anywhere. Like,
when you say proper washing, what do you mean?
I mean, scrubbing with soap. And I don't want to go into this thing I'm saying is very deep. It's deep. The wise will understand what I'm saying. Some people do actual dirty business. Now forget dirty business. I'm not talking about babambola here. I'm not talking about money that they are giving, that bringing out with dustbins, bringing out from contaminated area surfaces and all that. People who actually in somewhere, right? And then when they are done, because it's somewhere, it's not a hotel, it's not Transcorp or Sheraton, it's not in a hotel.
Yeah.
So they don't find a good environment to actually wash their hands. So what you may not know is where those people are coming from and what they did with their hands. You understand?
So you're saying be careful even when you want to shake someone.
Exactly.
Hey, okay.
So if you are the kind of person who loves to shake a lot, that means you also form the habit of washing your hands a lot. Okay. So now the next thing I mentioned, food. Which other thing? Hospital. Yes, in the clinic. So when you are caring for sick people, so as a health professional, if you are taking care of sick people, or even at home, you have sick people that you're taking care of, they're having flu, they're having some issues or respiratory or digestive issues or whatever kind of illness it may be, you need to also wash your hands often, because you can easily spread the contamination or spread the illness from one person to another, and also because of yourself. Because sometimes there's some...
So if you don't wash your hands regularly or frequently or the right way, you can also pass infections.
Exactly.
By shaking.
Exactly.
Oh, wow.
Exactly. So now, and there's some irregular habits that we have. Sometimes we don't know when we do these things, like biting on our fingers, poking on our faces, touching our eyes, and trying to,
I told someone the other day, can I give you a shovel? I do need a cutlery for you to pull it out.
Okay, maybe a shovel would have been better. So all that, you don't know what you're going to do next. Your hands are not really so predictable. So as much as possible, you need to also keep cleaning your hands. You need to keep washing your hands. You need to keep sanitizing your hands. Whether you are chewing on something as small as cheese balls, or you are chewing on coconut or anything at all. So you need to be careful to actually ensure that your is what? Schools. Good. So in schools, in classrooms, when children are done from their break time, before they come back and eat, or before they come back and continue whatever they are doing, they should have like hand. I know I'm going to still elaborate more on this, but there should be like hand washing stations. Like if they're coming back from school, the teachers can lead exam, make it true example. Coming back from break time. That's pretty amazing. That's pretty amazing. When I was growing up, I didn't really have such experience, but I believe we're really doing better now.
We're stepping up.
Yes, we're stepping up. So that's basically the four. I've mentioned four of them, right? I've talked about four of them. Yes. So those are the points, strategic points that we should always try to wash our hands. You go to a hospital, come out from the hospital. As you're coming out from the hospital,
Before
please
and
wash your hands.
after. Okay,
Yes,
yeah.
even while you're going to attend
While
to a
you're
sick
going.
person,
Okay.
wash your hands. And as if you're a health care
Practitioner or
practitioner,
officer.
you also need to make a constant, like a frequent habit. Make it a frequent habit to always wash your
Wash your
hands.
hands. Okay, so effects of hand sanitizer compared to soap and water.
Okay, so most hand sanitizer brands, produce sanitizers with 60% or above alcohol volume, alcohol content.
Mhm.
Um, you know, and that is basically enough to help kill bacteria.
Okay.
Okay, but there's a difference between bacteria and viruses. I won't go into all the details,
Mhm.
but then I would say the structure, the protein structure for viruses are quite tougher to break, and usually it's more advisable to, when you can, use soap and clean water to scrub your hands very well. There are certain things that you may not be able to remove with hand sanitizer. If you work on a dirty surface, for example, and you put hand sanitizers on your hands, hand sanitizer on your hands, it's going to make it more messy. You start getting some debris on your hands, and at the end of the day, it's going to be more messy, right? But if you're going to, whether it's grease or dust or dirt or anything, and you can't just eat, you can't say, I want to go and eat fufu and egusi. Oh my goodness, I want to go and eat food, right? And you now use hand sanitizer to sanitize your hands, and you start digging into the.
No, but I think hand sanitizer is just like you trying to clean your hands, but you still need to wash your hands
Yeah,
with soap and
yeah.
water.
So I go ahead.
Okay, because I remember during the COVID-19 in 2020, we were taught that at the moment, in case you don't get to see water and soap, you can just, use the hand sanitizers to prevent. And then when you get to a place where you have water and soap, you wash your hands under running water with soap.
Absolutely.
Okay. So I'm just telling you
Yeah. So
what I
it's
know.
more like first aid for hand washing.
Yes, verse 8 for hand washing.
Okay.
Okay, all right. So that is nice. So you're saying that there is importance of you still washing your hands with soap on the running water.
Absolutely.
Hand sanitizer is just a first aid to hand washing. Okay. Now, how can you recommend a proper hand washing technique? I know we talked about it, but can you just repeat it in case of my friend who just tuned in now? By the way, you are listening to Health and Wealth Show on the Democracy Radio 104.9 FM Abuja. Trish is my name. I am the host of the host, and I have Dr. Chijoke here. We are taking a look at hand washing because yesterday was Global Hand Washing Day. Let's take a breather, and then when we return, we'll tell you more about uh, how recommend the doctor is going to recommend a proper hand washing technique. Don't touch it. Good morning. So when we come back, we are going to talk about hand washing technique. All right, got to know you're still there. Good morning, and thank you for staying tuned on the Democracy Radio 104.9 FM Abuja. You're still listening to Health and Wealth Show. Now, this show is designed to bring us up to speed when it comes to our health and also give us the right information on how to take good care of our health and also having a good, healthy lifestyle because your health is your wealth. All right, so Dr. Chijoke is still in the building and we are taking a look at hand washing and importance because yesterday was Global Hand Washing Day. Now, doctor, can you recommend a proper hand washing technique?
Okay. So just like I talked earlier, the summary of it is ensure that you are scrubbing well.
Ensure you're scrubbing
Ensure
well.
that it is lathering. Ensure that you're
It's not
getting
just
enough
foaming.
foam.
it's not just foaming, it has to work because there are some hand wash or soaps that it will foam, but it's still not they come out the grease, the oil, the
Exactly,
stain.
exactly.
So is there a particular kind of a soap? You don't need to mention the company, but you can just maybe tell us the is it meant to be like methylated hand wash
Uh,
or antiseptic hand wash or just
Okay, so it's not really necessary to go antiseptic or
okay,
use methylated, or
okay,
it's not really necessary. Your the bath, the soap that you're using to make your bath, mild, more, especially if you want to eat though,
mm,
more milder ones would be better.
okay,
If you want to eat food, it's better to use mild alternatives.
okay,
All these there are hand washes also available. There are hand washes that are available now that are actually made for hand washing. So you can just go press some of it and then you use it and you're sure, okay, this was actually made for the hands before you do other activities like eating and the rest of them. So yeah.
okay. All right. All right. So, what role does hand washing play in preventing hospital acquired infections? Let me take it again. What role does hand washing play in preventing hospital acquired infections?
Okay, good. Now this is a very amazing question because oftentimes carelessness within the healthcare system can actually prolong a patient's stay in the
Hmm,
hospital. And
really?
yes, it can keep diseases, or let me say infections, running around a cycle.
Hmm,
So at some point the cycle has to be broken. So let me say, for example, in the management of let's say a respiratory illness,
okay.
right? Call it flu, call it anything, or a digestive tract issue, right?
Okay.
Digestive tract infection, for example. Now, you see that if the person working with you, or if even if you as an individual, if you are not taking care of such your hand hygiene, if you're not attending to your hands the
Mhm.
right way, it's going to be easy to just keep repeating that cycle. So
Yeah.
you get better, you come back, you get better, you come back, and it's the same thing for hygiene on the part of healthcare workers.
Okay.
So if I am working for a patient with skin infection, for example, and I do not do proper hand hygiene, it's
Okay.
going to be easy for me to transfer that infection
To
from
another
one
patient.
patient to another patient.
Okay. All
It's
right.
it's very easy to spread. So whether it is respiratory, whether it is body fluids, contamination as a result of contacting body fluids, and I do not, because even if you say using hand gloves, oh, I'm still going to use hand gloves as health professionals, and then I don't have to wash my hands. I realized something. Sometimes these hand gloves can cut, they can tear
Mhm.
in the middle
Yes.
of a
Yeah.
procedure.
All right.
I'm a physiotherapist and I work with patients, and I have to do manual therapy. I have to, use my hands to work with them. At some point, the hand gloves can actually get ripped, and at that point, you're also contacting the patient directly. So as much as possible, hand hygiene is important, whether or not you're wearing gloves. In fact, it's recommended that you should wash your hands before you put on gloves. So
Okay.
as I'm coming into my workplace in the morning, it is expected that, okay, I should go have a good hand wash my hands properly, and then start attending to patients that I know that, okay, at the point of removing the glove, the first one, I'm
Mm-hmm.
either going to put in another one, or I'm going to
Mm-hmm.
wash my hands and wait. So that's it. It's really, really important in breaking the cycle of transmission.
Okay. So wash your hands before you put on your gloves,
Yeah.
and then wash your hands after you take off the glove.
Yes.
Okay. So a glove is per patient.
Yes. A
Oh,
glove is per
that's
patient.
okay. That's really nice. In case you just tuned in, you were listening to Health and Wealth Show on the Liberty Radio 104.9 FM Abuja, and we're taking a look at Global Hand Washing Day. It was yesterday, but we decided to talk about it today. And another thing you need to know, in case you have questions, by the way, if you have questions, you have contributions, feel free to call in and then let's hear from you. We'll love to hear from you. 0810 885 1189. That is the studio line you can call in right now. You can also send in WhatsApp messages to 0906 199 9009. And I'm seeing a lot of messages here. Hey, good morning to you too. This is greatness. Yeah. Fitness, good morning, how are you? And also IB from Wally, good morning to you. And in case you have questions, feel free to, send them in. I'm here, and Doctor is also here. All right, so let's move away from the hospital required, conversation. How does hand washing impact materials and child health?
Okay. Ma-
How does hand washing impact
Maternal.
maternals? Yes, thank you.
Okay. Okay.
Maternals and child health.
Okay. How it impacts maternal and child health. So we're talking about women and children.
Yeah,
You know.
because it's important. So
Yeah.
imagine a mother who just gave birth to a baby.
Mm-hmm.
Yeah, stuff like
You know. I'll start this by telling a story,
that.
and
Okay.
I'm going to link it with a lot of things. And one of the reasons they said, when a woman gives birth, the child is still growing. The child is under 6 months, under in fact, under a year. It's it's very important because at that phase, the child's immune system is still developing. It is very important to not allow people kiss the child on the face, anywhere around the face.
Mm.
And I'll tell you, this is I saw a story recently that broke my heart. A little baby acquired cerebral palsy, as a result of brain infection. And this infection came because when she was still small, healthy, normal, healthy baby, a visitor, I think a relative, came on and picked the baby up and kissed the baby on the face. Now, that visitor, they later found out that he had a sore on the mouth. So there was an infection, and that passed to the baby because the baby's immune system wasn't strong enough to handle that. Went through the bloodstream, penetrated the blood-brain barrier, and invaded the brain, right? And that caused her damage, caused her, she couldn't use one side of her body. It was more like stroke for children, right? She couldn't use one up till date, right? She's still suffering that. And this is why maternal hygiene is important, because everything that affects the woman affects her baby. So even through breastfeeding, oftentimes you see women do this. They're breastfeeding, but they have to use their hands, whether they are using the thumb or they are using a C cuff, or the digits, the index finger and the middle finger, to position the nipples for the baby to be able to suckle. But then you notice that if that hand is contaminated, it's very easy to pass the infection or whatever, pass the disease, the virus, the bacteria, the germs from the hands to the nipple, and then from there to the baby's mouth, and then to the baby's gastrointestinal, the digestive system, and then enters their blood and actually harms them. So you see sometimes where kids are having some issues, or they're stooling, it's diarrhea or whatever, they are, they're uncontrollably stooling. And sometimes if you start tracing the origin of that, even though it may be hard to find out, it may be the hands of the mother. So it's very important to break the cycle of transmission from mother to baby, transmission of infection, transmission of any kind of diseases from the mother to the baby.
All right, so it means it's important that as a mother, you need to wash your hands before you feed your baby
Absolutely.
and wash your hands after. In fact, wash your hands every single time you want to
Absolutely.
deal with your baby.
Mm-hmm.
Okay, and also now the nipple. I heard that before you even feed your baby, you need to wash your breast properly because of infection. Because you must have gone through tedious work and you're sweaty, you're sticky, so it has to be clean because the baby, like you said, immune system isn't strong yet. Okay, that is really enlightening. I appreciate that one. Thank you for bringing that to my knowledge, and I will educate mothers more because I already know about the make sure say that place they clean before, but I didn't know about the hands. That is why this particular topic is really, really. You may think it's not just to wash your hands, but there's more to it because we have more germs on our palms inside our fingers, so we need to make sure that we have our hand hygiene number one on our list to make sure that we wash our hands regularly, right? How can you discuss the economic benefits of hand washing in low resource setting?
Okay, so well, the thing is, the benefits are the same, whether
Okay.
low resource or high resource. The
Oh
benefits are the
wow.
same. So
Okay.
we're not going to say because you have resources, then you can start taking risks.
Mm.
Okay, because maybe this is a place where there are a lot of resources. Then you climb a skyscraper and then dive out
Mm.
and then start hoping that resources are going to catch you. Sometimes the consequences of things we do not know or things we ignore, they exceed the risks involved in actually knowing them or avoiding them. So ignorance is not an excuse. Now, however, for low resource communities,
Mhm.
proper hand washing helps reduce, because this is when I was learning about COVID-19. There were a lot of calculations then. I did a lot of calculations, some of the programs I did, and the interesting thing I found out is, the exponential potency
Okay.
of diseases and infections.
Okay.
So that means if you allow one person to get infected,
Mhm.
right? It's not going to stop with that one person. There's risk that, oh, here that one person is going to go home and meet their family members. So the wife is going to go home, meet the husband, who will meet the children, and the children will go to school and meet their classmates, who will go to church and meet other people in the church, and probably meet the pastor, who will keep spreading it every time. And then the whole cycle just continues until somebody wakes up and decides to exit from that straight line, that chain, right, and break it. So it's very important, especially because now when this thing starts to spread, it's going to be very hard to contain in low resource communities. So my recommendation would be that, as much as possible, instead of even waiting for these things to start happening, for an outbreak, before we start doing emergency intervention projects and plans, we can start establishing small projects that can help prevent these things from starting.
Okay, so talking about small projects, what are the specific hand washing challenges in our local
Okay, the first one I'm going to say is knowledge and awareness.
community?
Okay, one is knowledge and awareness, and then two is the resources,
Okay.
the basic amenities that are available. So it's not in a lot of local communities that you will get to, and they have access. Let them even have access to clean water at least. It's not everywhere that they have access to clean water, that they can actually get the clean, because we are advocating washing hands over running water. Clean running water, not any running water, clean running water and soap. Now, it's not every community that people can even afford good soaps.
Okay, good. You made mention of clean water. I let it slide. You said it again. How would you know which water is clean and which water is not? Apart from the normal pot yellow water that we know.
Mhm.
But there are some water that is as clean as this and it's not clean. So how do you ascertain which is clean and which is not?
Okay. I would say there are bodies, right? There are bodies in every country responsible for determining, environmental regulation, determining the safety, the food safety, water safety, and how clean, hygienic what we are taking into our bodies are. There are bodies responsible, there are organizations responsible for that. They are actually the ones to certify and say, okay, this water board is safe for consumption, is safe for hand washing or whatever. Now, but on the basic level, one, water, basic properties of water. I mean, water that is drinkable. It should be, what will I say? It should be colorless, odorless, tasteless to a huge extent. Some people will argue that water is not really clean water is not really tasteless, but to a huge extent, if you start drinking water and then you have some foul taste or something just going off there, it's a sign that, okay, this is not also safe for me to use and wash my hands. You shouldn't be seeing particles inside.
Okay.
Sometimes you go to eat and then they bring water for you to wash your hands, and then you're seeing particles, things moving around, just flying inside, enjoy themselves. Exactly. So you don't want to come and use that kind of water to wash your hand for something that you're still going to put into your mouth.
So you have a right to say, please change the water.
Exactly. What I do most times, let me confess, when I go to eat, a lot of times, if I'm eating out, of course, I would request. I'll request, okay, do you have a tap here? I can wash my hands, right? Otherwise, get me clean water in a jug,
So you just
exactly.
so
Please,
that
can
you
you
can
help
pour
me
it.
and pour and
I think
I, and,
that's
and I
nice.
wash? and after the whole thing, they'll discard the water and get new one. When I'm done, I'll wash hands over that inside that new one, and then go outside again and wash my hands over running water if I have to. Now, interesting thing is that particular there's one particular woman I usually eat at her, at her restaurant. So she knows me. So immediately I come in to eat. She's like, "Oh, I know you, hand washing guy, the hand washing guy."
I like it.
I know you want to wash your hand. Oh yeah, go outside. There's tap outside. Every time she'll be like, "Hey, there's tap." I know you asked me for tap. There's tap outside.
Nice.
Take soap, take liquid soap, go and wash your hands. So she already knows that, and then that's like she makes it a priority. And oftentimes when I do that, I'm also some people are able to, kind of get some influence from that. Okay, why is this guy washing? Why are you even overdoing? You are overdoing. See water here, wash your hand. Like, no, 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 no. This is giving bacteria a good breathing space. So I'm equally spreading advocacy and awareness at that point. So yeah.
Nice. Okay. So how can we improve hand washing infrastructure in our health care facilities?
Okay. Now we can actually do a lot by personally advocating for such,
Okay.
and at the top management level, at the executive and management level, they can actually try to set up projects that would, and this will come through feedback. There's no let me say, I want to say rehabilitation, but there's no actual implementation, public health implementation project that will go without asking questions. So you have to be able to ask the right questions, get the stakeholders, ask, okay, where do we need hand washing stations here? What do you think we will need to improve hand washing hygiene? Maybe putting flyers, something as simple as putting hand washing reminders on different desks, on different walls.
Don't forget to wash your hands.
Exactly. Don't forget to wash your hands.
Think about washing your hands to save your life.
Good, good. And if there can be hand washing, mobile hand washing stations that can be planted at different locations, strategic locations. So you're about to enter the ICU, wash your hand. You're about to enter here, wash your hands. You're about to enter, you can't cross this boundary without washing your hands. So it's going to be a lot easier for us to control communicable diseases that can be spread through, contaminated surfaces or body fluids or whatever when we are actually implementing such projects. So it doesn't have to be so high and mighty. Of course, we should do the high and mighty projects, but these little ones here and there can change a lot of things.
Thank you so much. That has been enlightening. But before I let you go, I have one or two questions more for you. Now, what hand hygiene practices should be followed in schools? Because it starts with our kids. They need to learn this so they can grow up knowing this and to know how important it is. I remember when my kid sister was growing up, she comes back from school. Ah, auntie, my teacher told us this. My teacher taught us this. So we should start doing it at home. So, what hand hygiene practices should be followed in school?
Fantastic. Catch them young. And I love that when you started asking that question, immediately you started asking the question. I had something in mind, and it wasn't long. You said what I had in mind.
Oh, wow.
Teachers should set the examples. See, we live in a world where it's easy to talk and not do.
Talk not.
Exactly. Now, children, being children, they learn by role playing. They learn by seeing what we do. They are more pragmatic than we think. They are kinesthetic learners. So if you come and tell a child, "Oh, I want you to be reading your books every time," and they see you're always on your phone, they're going to copy what you do, not what you say. No matter how much you force them, they're going to keep copying what you do. So the same way, if you come and tell the child, just keep washing your hands, wash your hands every time, wash your hands regularly. But then you as a teacher, you come back from break time or whatever, you finish handling chalk. The same hand you used to handle chalk now is markers. So and everything. You are okay. That's right. And then the same hand you use it and grab some pieces of upper and throw into your mouth. And these kids are watching you.
And they're watching.
Exactly. So they are also beginning to subconsciously believe that they can use dirty hands and grab pieces of upper and throw into their mouths. Okay. So as much as possible, exemplify what you want them to see. Show them. Take regular breaks. After break time, oh, we're going on hand washing, whatever. Ensure you wash your hands before you come into the classroom. When they come in, inspect the hands, check the fingernails and all that. Teach them how to do these things. teach them the WHO or the UNICEF protocol, whichever one, and those things make it really interesting for them. And the truth of the matter is, when we raise children, when we train children, or when we educate or empower children, we also underestimate the amount of people we are empowering, because these kids are going to go back to their homes, they're going to go back to their houses, and they will tell their parents, oh, see what my auntie taught me. Ah, daddy, don't wash your hand like that. This is not what Auntie Gigi taught me. This is not what Uncle Chijoke taught me. Whichever, they're not going to take it so easy with their parents who are doing it wrongly,
Yeah.
and then they're going to disturb them so much that their parents will have no choice but to do what they are saying. Okay, so a lot of African parents can actually learn from their kids if their kids are learning the right thing in school, helping us to to create a safer world health wise.
Thank you very much. And yes, we have been talking about hand washing. And yes, Dr. Chijoke has been my guest, is still my guest in the studio, and we've been having an amazing conversation. This is Health and Wealth Show on the Mercury Radio 104.9 from Abuja. And Trish is my name. All right, so just a quick reminder or a recap of all we've talked about this morning. Just key messages. Hand washing with soap and water reduces diarrhea by 47%. Hand washing prevents infections, you know, illnesses, and it helps us to live even better. Also, hand washing reduces um, infections, jam, especially in schools, right, doctor?
Yes.
Uh-huh. And also workplaces. Hand washing is essential for maternal and child health. Importance of hand washing habits is good for you. So make sure you wash your hands regularly. And we said wash your hands before you eat with soap under running water. And then wash your hands after you're done with your food. Wash your hands when you use after you're done using the restroom. Wash your hands before you touch your face. Wash your hands because unconsciously you poke your nose, you poke your eyes, you also bite your fingernails. These are unhealthy habits. So wash your hands regularly and also promote hand washing in schools and communities. It is important. I remember at the course of this show, I told us something that was shocking, that is shocking. And I told you that 1.8 billion people worldwide lack access to basic hand washing facilities. This is coming from the WHO, which is really sad. And also, diabetes kills 525,000 children under 15 annually. This is also coming from the WHO. So we need to learn to wash our hands regularly. Doctor, before I let you go this wonderful morning, what will be your advice to my friend listening right now regarding hand washing?
Regarding hand washing,
Yeah.
I want us to treat this with utmost concern and seriousness, because it's common to hear this, and I know how much it breaks my heart. It's common to hear, what a man doesn't know won't kill him, and then our forefathers have been doing it this way. Please and please and please and please, it's time to start taking the right steps, the right action towards your health. And as much as possible, you can set the pace. You can become the difference in your workplace, in your office, in your family. And this will help us to break the cycle of diseases. Remember, preventive healthcare is the best form of healthcare. And with that would reduce a lot of cost in managing diseases. So go ahead, wash your hands and do it properly.
All right, go ahead, wash your hands. Here is my best piece of advice to you. Do the inner work. Get 7 to 8 hours of sleep or what you eat. So start eating healthy. Drink your water. Stay hydrated. Learn to meditate. Open a journal and write down your emotions. Exercise your body because your body deserves it. Fall in love with reading and find a creative pursuit. When you don't make time to care for yourself, eventually you'll make time for illness because your health is your wealth. This is where we're going to draw the curtain for today. And don't forget, there's going to be a repeat broadcast for you on Saturday, 9 a.m. to 10 a.m. I have been talking with Dr. Chijoke. Why are you looking at me like
I was waiting for the last one.
that? Otipa.
Yeah, you got it.
Yes, I've been having an amazing conversation with Dr. Chijoke Otipa. He is a physiotherapist and also a holistic life coach. Thank you so much for coming and thank you so much. We appreciate it.
Thank you. Thank
All
you.
right. All right. So do well to follow us up on all our social media handles, Facebook and Instagram at Democracy Radio. And on X is Democracy Radio underscore. You want to follow me up on Facebook and Instagram is at Trish the Goddess. And on X is Trish underscore D underscore Goddess. It is spelled TRISHDGODDESS. So I come your way. Next time on Health and Watch Show, from me to you is spread the love and not the violence. Good morning. Whew, that went well.
So, guys, it's been an amazing time hanging out here on Democracy Radio.
Yeah, it
And
has
this
been.
is Trish the Goddess. This is my wonderful host for
Hi,
today.
good morning. I don't know why I like doing this. I think it's nice.
Yeah, that's good.
How are you? Hope you guys are doing good. And hope you learned something today because I did. Thank you so much, Dr. Chijoki.
Thank you. Thank you, Trish. Bye. So, how did I say this thing the other day?
What?
Um, keep watching
Health
Democracy
and Wealth Show
Health and Wealth Show with Trish
on Democracy Radio.
on Democracy Radio.
And you can also catch her by 6 p.m. to 10 p.m.
Okay. So keep watching Health and Wealth Show with Trish on Democracy Radio.
Or listening.
Listening. Yeah, tune in to one radio Democracy Radio 104.9 FM to join Health and Wealth with Trish. Trish the Goddess. So Trish, what's the Instagram handle again?
Trish the Goddess.
Trish the Goddess. Okay. So thank you all for coming. Thank you all for watching, and I hope you learned something. You are going to do a lot of good if you decide to break the cycle by washing your hands properly and spreading this good news. Of course, good news. So bye.